All right, we are going to talk about the cardiovascular system, which is chapter 6. There is no doubt that this is a bulky chapter and a lot of information to process and understand, but knowledge of the cardiovascular system is vital to the role of phlebotomist. It helps us to understand what we're doing. It helps us to understand the effects of our blood collection on the results of the tests obtained, etc. So again, this is a lengthy chapter. There's a lot of information, and it's going to require on your part some practicing, some reviewing, some probably, getting a diagram and labeling the different parts of the circulation in the heart, maybe the inside of the vessels as well, to really get a good understanding of this. You'll see under this lecture video here, I have also attached several videos that we have found that are really helpful to just kind of understand some of these basic concepts and more complicated concepts. You'll even see a couple of them are kind of geared actually towards kids, but don't be offended by that. I watch and enjoy them. In fact, my kids turned me on to the one duo. It's the Operation Ouch. My kids love watching it, but I sit there with them and I learn a lot of things watching Operation Ouch as well. So it's great. Sometimes it takes bringing it down to, a simple level, a simple conversation, hands-on demonstrations for us to really get it. And so whatever works, right? So read through your book, listen to the lecture, listen to your videos, and then do some practice, okay? So when we're talking about the cardiovascular system, again, I'm going to talk about several things in this lecture, including how the heart is, or how the blood is circulated through our heart and body, the purpose of the vascular system, commonly used veins that you as phlebotomists are going to use for draws and venipuncture, major components of the blood, because you do need to have an understanding of that and why, or I should say the function of each of those components. We're also going to talk about hemostasis and the basics of coagulation. Hemostasis is important to understand as a phlebotomist as well. That's simply the stopping of bleeding, right? Something you're going to be doing on a daily basis. And also we're going to end with a little bit of discussion about blood typing, so including A, B, O, and RH blood types. All right, so some things to remember. The cardiovascular system is responsible for circulating blood throughout the body. Adults have an average of about 8 to 12 pints of blood in their body at any given time. So 1 pint is about 1 unit of blood, because we hear that a lot. We'll hear about, someone getting a transfusion. The typical transfusion is 1 unit of blood. To kind of put that in perspective in another way, 8 pints is about 1 gallon. Also, we have about 70,000 miles of blood vessels in our body. Another way to look at that is if you were to stretch those vessels between New York City and San Francisco, you could go back and forth at least 24 times. And remember, blood is moving constantly and continuously through all those vessels and through our heart. All right, so let's see here. So circulation. The vascular system consists of several tube-like structures, which are our blood vessels, which vary in size and structure, but they're all connected. The important thing to remember too is that they're all in a closed circuit. So the closed circuit of vessels along with our heart are responsible for circulating all of that blood through our body. The heart itself is a large dual pump muscle. Let me flip over to this page. I'll go back in just a second. And it's important for you to understand how the blood flows through the heart. It's also important to understand the parts of the heart. So let's look at this diagram here. You've got in the middle, you can see that kind of thicker wall. That is the septum. This is what divides the heart in half about in the middle between the left and right ventricles. The heart is also divided from upper to lower, and you can kind of see it. It's harder to see that division in this image, but the left and right atria are at the top, kind of more like that, and then the left and right ventricle at the bottom are the more conical shapes, okay? Let's see what else here. The right side of the heart is what carries deoxygenated blood, whereas the left side of the heart carries the oxygenated blood. And the heart consists of, these different valves that help to make sure blood is flowing in the proper direction and that there's no backflow. Let's see. The valves that separate the atrium from the ventricle are the tricuspid and bicuspid valves. And you can see that on the label here. The tricuspid valve is what separates the right atrium from the right ventricle, whereas the bicuspid, also known as the mitral valve, separates the left atrium from the left ventricle. There are also valves that separate the ventricles from the body, essentially. So these you'll see, let me see if you can see it. You see where it says the pulmonary valve. This is actually called the pulmonary semilunar valve. And then there's the aortic semilunar valve. And they're called that because of that shape that they have. And you can see that in the pulmonary valve picture on here. All four of these valves are designed to, again, prevent backflow. So once the heart has pumped blood into, from the right ventricle into the pulmonary arteries, you don't want it to flow back into the right ventricle. You want to keep it going in the proper direction. So something else to know about the heart is it is divided into 3 layers, or it consists of 3 layers. You've got the endocardium, myocardium, and epicardium. The endocardium is the inside layer. This is lined with endothelial cells, which is similar to the lining of our blood vessels, which we've talked about before. The myocardium is the middle layer of our heart. It's the thickest, and it's a muscular layer, and that's what's responsible for that contraction and relaxation of the heart. You'll notice, I'll flip back, in this picture, the left ventricle, again, remember you're always looking at your patients, these anatomical pictures, from an anatomical perspective. And so you've got to think about left and right in the anatomical sense. So again, if you look at the left atrium, or excuse me, the left ventricle in this diagram, you'll notice that it has a thicker muscular wall. And that's because the left ventricle is the chamber of the heart that's responsible for pumping blood to the entire rest of the body. So it's got to be extra strong, right? The epicardium, this is the outermost layer of the heart, consists of 2 membranes. The inner, which is a visceral membrane attached to the heart directly, and the outer membrane, which is more fibrous. And those 2 membranes in between them have what's called the pericardial fluid. So you have these 2 membranes with the pericardial fluid in between. That's needed because if you think about the heart's constantly moving and pumping with a lot of friction and force, you need that fluid to act as a lubricant to allow the heart to move normally. All of those, the 2 membranes, the inner and the outer membrane and the pericardial fluid, are all combined to form what we call the pericardial sac. Let me see if I've missed anything here. Okay. So it would be, like I mentioned on the introduction on the first slide, look in your book. They have several really awesome diagrams. Look at this slide. Quiz yourself. Practice tracing the flow of blood through the heart and out to the body and the lungs to see, to practice until you get a kind of a good sense of that. It really is somewhat, it's not all memorization, but the memorization of the flow and how this works helps to gain that understanding and comprehension of what our body's doing. So the heart and vascular system are responsible for the transportation of blood through our heart, our lungs, and our body. So we actually have 3 circulation systems, okay? We have the coronary circulation, which relates specifically to the circulation of blood through our heart. We have the pulmonary circulation, which relates to the blood as it passes into and out of the lungs, and our systemic circulation, which is relating to the rest of our body. So I am going to talk about each one of those circulating systems individually. So, and I think I'm going to stay on this slide for this. Yes. So when we're talking about coronary circulation, again, coronary is heart. This is, again, what supplies blood to the heart specifically. You are going to see oxygenated blood travels from our left ventricle. And you can look at these slides as I'm talking through this, it might help, or these images. So oxygenated blood travels it's in the left ventricle. It goes through our aorta, where most of that blood's going to go to the systemic circulation, but once it enters the aorta, there are some branches called our coronary arteries that are what feed the heart itself. We have the left coronary artery and the right coronary artery. The left coronary artery does have more branches. Think about why. It's going to the left side of the heart. What do we know about the left side of the heart? It's got that thicker muscle. It needs a lot more blood supply to function properly. Once oxygen has been distributed to the heart, it's taking oxygen off of that blood, right? It's going to travel through the coronary veins and then empty into the right atrium, which will then go to the pulmonary circulation to get more oxygen back in the blood. All right, bear with me. We're going to move on to pulmonary circulation now. So once blood has circulated through the body, and through the coronary veins, it has become deoxygenated. So that blood needs to get oxygenated again, right? So in pulmonary circulation, we're starting with deoxygenated blood from the body entering the heart into the right atrium. From the right atrium, that blood is going to travel to the right ventricle, and then it's going to go through the pulmonary arteries to the lungs. Now, something important to notice here. Pulmonary arteries are the only arteries in the body that carry deoxygenated blood. Arteries take blood away from the heart into the body for circulation. It's oxygenated because it's delivering oxygenated blood to the rest of our body. The one exception are the pulmonary arteries because they are carrying deoxygenated blood into the lungs to pick oxygen back up. So in the lungs, like I mentioned, it picks up more oxygen, it's releasing carbon dioxide. And once that blood is reoxygenated, the path it goes through is blood flows through the pulmonary veins. Here's that other exception. Veins typically carry deoxygenated blood from our body back to our heart and lungs to get reoxygenated. Pulmonary veins are the one exception to that rule. They are the only veins in the body that carry oxygenated blood. So again, once blood has been reoxygenated in the lungs, it's going to flow through the pulmonary veins to the left atrium and then the left ventricle, where it can go out into our systemic circulation. And that's the final one we're going to talk about here. We've got our systemic circulation. This begins with the left atrium, where we just got that freshly oxygenated blood from the lungs. Left atrium is going to dump that blood into the left ventricle, and then that left ventricle is going to, with a lot of force, pump that blood up through the aorta, where it will be spread out into the systemic circulation. Now, I know you see some images on here. You see the superior and inferior vena cava. Those are the largest veins of the body. Remember, veins carry deoxygenated blood back to the heart and lungs. So the vena cava are the largest veins. That's where the blood is returning from the body. Superior vena cava, pretty much any blood that has been circulating through the upper portion of my body comes down through the superior vena cava. Any blood that's been in the lower portion of my body below my heart is coming in through the inferior vena cava into the right atrium. Let's see. Okay, so again, review over those three different systems of circulation and get comfortable and familiar with those. Now let's talk a little bit about the blood vessels. So there are three main types of blood vessels in our body. We've got arteries, veins, and capillaries. And I'm going to talk a little bit about each of those and then the structure. You do need to know the structure of the veins and arteries. You guys are performing venipuncture and dermal punctures. You're going into the veins with the venipuncture. So you've got to have a basic understanding of what you're working with and what you're doing. And of course, the risks associated with that. So arteries, these are vessels that transport blood away from the heart, again, with the exception of the pulmonary arteries. Did I say that correctly? I think I did, right? Arteries, vessels that transport blood away from the heart. All arteries except the pulmonary arteries carry the oxygenated blood. Veins, on the other hand, transport blood to the heart, and all veins except the pulmonary veins are the deoxygenated blood. So the largest artery is the aorta. The aorta branches into smaller arteries. Arteries branch into smaller arterioles, and arterioles branch into smaller capillaries. Kind of want to understand that progression as well. Then we go the other way around. So we have venules, which join together to form larger veins. We have veins that join together to form the superior and inferior vena cava. And the venules are at that capillary level. You get the capillaries and then you go to the venules, all right? So capillaries are the smallest of the blood vessels and also the most numerous. Capillaries are what connect the arterioles to the venules, and they deliver oxygen and blood to all of our tissues. Structure of the blood vessels. So look at this image as we're talking about this here, because both arteries and veins are composed of 3 layers of tissue. The capillaries, on the other hand, only have 1 layer of tissue and allow for selective permeability. And I'll talk about that in a minute. But because the capillaries only have 1 layer of tissue, they are very small and tiny, they're microscopic. And in fact, red blood cells can only travel through the capillaries in like single file line, whereas in the veins or arteries, it's just a rush of them, right? All right, so let's back up here. We're going to talk about the structure of the blood vessels. You've got the lumen. All that a lumen is that hollow passageway in the arteries and veins to which blood travels through and cells travel through. Then you've got the tunica intima, tunica media, and tunica adventitia. The intima is the innermost layer of the veins and arteries. This is what comes in direct contact with the blood. It's a smooth layer. The tunica media is the middle layer, and therefore, well, not therefore, but it is also the thickest layer. This is what contracts and relaxes to keep blood moving through the veins and arteries. The tunica adventitia is our outer covering. It protects and supports the vessels. Arteries are considered, well, I won't say that. So let's talk about the arteries first. Their walls are elastic and muscular, and as you can see in this image, much thicker than the walls of the veins. And that's because they have to be able to withstand that pressure from the blood as it's being pumped out of the heart. So when that left ventricle pumps and pushes it out to the aorta and then into the rest of the arteries, it's under a lot of pressure. So these arteries got to withstand a lot of pressure. That's why the blood flowing through these arteries is fast and pulsating. As the heart beats or contracts, that's when you feel a pulse. That's the blood being pushed through the artery under high pressure. Common places where you might feel pulse, radial pulse, and carotid. Again, it's fast and it's pulsing. Many arteries, when you're looking at the body system, there's some images in your book where you can see the arteries and veins of the body. Arteries are paired and have a left and right artery, often with the same name. So veins. Veins also usually have the same name as the arteries they run along, but because there's less pressure in the veins, the force is not as great. So whereas the arteries are fast and pulsating, veins, the movement of blood through the veins is more like slow and oozing. So muscle movement does help push blood through the veins, but veins are often moving going against gravity. So unlike arteries, veins do have valves. They have one-way valves that assist in forcing that blood to the heart and also preventing backflow. So they let the blood in, but they don't let it back down. Veins also serve as a reservoir and actually store about 65 to 70% of our body's total blood volume. There are several reasons, and I've already named a couple, but let me point those out, that we use veins for venipuncture. Like I mentioned, it stores a large amount of our blood. It's like a reservoir for our blood. The walls are thinner, not as muscular, so they're easy to get through, and that lower pressure. You puncture an artery, you're going to have a high amount of pressure, blood squirting out. You puncture a vein, it's that oozing, right? Let's hop back to the capillaries for just a minute. I've already mentioned they're microscopic in size, and this is where the gas exchange occurs. This is where oxygen is let off and carbon dioxide is picked back up. I mentioned that they're a single layer of tissue and allow for selective permeability. What that means is that substances can pass in and out of them. We mentioned the carbon dioxide and the oxygen already. Nutrients and oxygen pass out. Waste products from the tissues and cells come back in so that they can be excreted by the body. Now let's talk a little bit about veins commonly used for phlebotomy. Phlebotomists need to be familiar with the veins that are commonly used. The most commonly used site for venipuncture are the veins of the middle arm and front of the elbow. This is called the antecubital fossa. Veins vary among patients, but there are two common arrangements that you will see, and it's simply referred to as the H pattern and the M pattern. So H pattern, the most common veins in order of how kind of like first choice, second choice, third choice are there on your screen: the median cubital, cephalic, and basilic. The M pattern in order of first choice, second choice, third choice would be the median vein, the median cephalic vein, and the median basilic vein. I'll talk a little bit about those. Let me see if I can move myself. There we go. So, okay, let's talk about these different veins. So when we're talking about the H pattern, the median cubital, located in the middle of the forearm, it's larger and closer to the surface and well anchored. That's why it's kind of the number one site. The cephalic vein, it's lateral to the median cubital vein. It is well anchored, but it's a little bit harder to feel or palpate. So good, but usually the second choice. Basilic, this lies medial to the median cubital vein. It is slightly easier to palpate usually, but it's not as well anchored. And the other downside to the basilic vein is that it lies closer to the median nerve and brachial artery. We don't want to puncture an artery, right? Okay. Also, we don't want to damage a nerve. An accidental puncture of the median nerve could result in temporary or permanent loss of function of the arm and would constitute as an act of negligence on your part as a phlebotomist. You can avoid this by choosing the other options first if you have that availability, but if you do need to use the basilic vein, a way to avoid puncturing that nerve is to avoid probing around, or you might hear it called digging. Nobody likes that anyway, all right? So don't do that. The M pattern. The most commonly used M patterns we mentioned are the median vein. This is the center of the forearm. It is well anchored and it tends to be less painful, and it's also further away from any arteries or nerves. So again, first choice in this pattern. Second choice would be the median cephalic. This is located away from major nerves and arteries. So again, not a bad choice because you have a lesser risk of causing any damage. The median basilic, this would be your third choice in the M pattern because it is located near both the anterior and posterior branch of the median cutaneous nerve, and it tends to be more painful for the patient. You also may be drawing blood from the back of the hand. This is called the dorsal arch. This is used when you cannot get good access or don't have access to the antecubital fossa. These veins in the hand are smaller, they're less anchored, and often it's a little bit more painful for the patient. And finally, on vein sites, you will also see blood obtained from other sites like the head, legs, or feet, but just know that these sites will not be drawn by the phlebotomist. All right, so we're going to talk about the composition of blood. And this is quite a lengthy bit, so I'm going to try and highlight and summarize here, but it is important for you to know about the composition of blood. I've already mentioned blood cells originate mostly from inside the bone marrow. Blood is responsible for transporting oxygen and nutrients to our cells and tissues, hormones to their target cells. It eliminates waste materials, maintains body water balance of the body, transport antibodies and other protective substances when needed. It assists with regulating our temperature, and it helps to maintain our acid-base balance. So blood, if it is left undisturbed in a test tube, it's going to separate naturally. Now, if it has a coagulant in there, that separates as well, but it separates into serum. But we're going to just talk about a blood that is not coagulated. It's going to separate into cellular or formed parts of our blood and the liquid or plasma parts of our blood. The cellular or formed parts of our blood include the red blood cells, the white blood cells, and the erythrocytes. Oh, I'm sorry. The erythrocytes are red blood cells. White blood cells, red blood cells, and platelets. And it is important to know that erythrocytes is another name for red blood cells, leukocytes, another name for white blood cells, and thrombocytes are another word for platelets. So, erythrocytes, let's talk about each of these different cells. We're going to talk about the red blood cells first. They do originate in the bone marrow, and they're constantly being manufactured. They are the most numerous of all of our blood cells. They are responsible for actually carrying the oxygen to every cell of the body and removing the carbon dioxide. This ability of the red blood cells or the erythrocytes to carry oxygen is dependent on the molecule hemoglobin, which is on the red blood cells. So each red blood cells contains several million molecules of hemoglobin, and that's what carries the oxygen. Hemoglobin is also where we get the red color from the blood. When fully mature, the red blood cells look like that donut shape that you see there without a hole in it. These red blood cells do live about 120 days, at which point they kind of lose their shape and don't function as well. So then they're just, basically eaten up by the body and gotten rid of. You're going to hear the term hemolysis. This is basically the breakdown of red blood cells. And this can happen when the body has different diseases or disorders. Certain anemias can cause hemolysis. Certain problems of the liver can cause hemolysis. And we're going to talk about that a little bit later on as well. Let me see if there's anything else I want to mention about the red blood cells before I move on. The average healthy adult has approximately 4.2 to 6.1 million red blood cells per cubic millimeter. This does vary slightly based on gender. All right, I think we're good. There's more to learn about the red blood cells or erythrocytes, but that's kind of some of the highlights. Now let's talk about the white blood cells or the leukocytes. As you can see from this slide, it further breaks down. There are many different types of white blood cells or leukocytes, but leukocytes are primarily responsible for destroying foreign substances and removing cellular debris. White blood cells do this by surrounding and destroying foreign substances in a process called phagocytosis. Essentially, what phagocytosis is engulfing the foreign substance and eating it, okay? Because of this, leukocytes are not confined to the vascular space. They can actually pass through the capillaries, the semi-selective permeability, right? They can pass through the capillaries and go out into the body, into the cells and the tissues to help fight infection. Leukocytes are round and clear, but because of the light that is used when we do view them in under the microscope, they do appear white. The average adult has 5,000 to 10,000 white blood cells per cubic millimeter. Of course, as you may already know, the number of white blood cells can significantly increase due to infection or certain disorders as well. Just some examples, again, bacterial infection, you're going to have an increase in white blood cells. Leukemia actually causes an abnormally high level of white blood cells. And the opposite of that, AIDS, is an example of something that can drastically decrease the number of white blood cells, therefore putting us at an inability to fight off infection or foreign substances like we typically would. A complete blood count, or CBC with differential, or a white blood count, WBC with differential, are often used to determine the different percentages and types of white blood cells in the blood. And when I say that, I mean right here, the neutrophils, eosinophils, basophils, monocytes, and lymphocytes. So neutrophils, these are the most numerous of all the white blood cells in adults. They contain the enzyme that helps in that phagocytosis. The average lifespan of a neutrophil is about 6 hours to a few days. They help defend the body against infection, and they move quickly to to engulf invaders. Also, something to know about neutrophils, when they do kill pathogens, they produce pus. So when you've seen pus from a wound, that contains neutrophils, pathogens, and parts of the cells. Eosinophils, these contain chemicals that assist in controlling inflammatory reactions to prevent the spread of inflammation. They can also phagocytize and destroy parasites in response to allergic reactions. Also, the eosinophils can help kill certain tumor cells. You will see an increase in eosinophils in response to parasitic infections or allergic conditions, and these cells live for about 8 to 12 days. Basophils. This is one of the least Common granulocytes, they do not phagocytize, so they don't engulf and eat foreign substances, but what they do is they assist to swell a local area in response to an injury or a foreign invader. So they don't eat it, but they increase blood circulation and blood supply to that area and swell that area. And this is done actually through the release of histamine, which dilates capillaries. When something is dilated, it's open bigger, allowing more blood flow to get there. Monocytes. So monocytes are the largest of all of the circulating white blood cells. Their primary function is that phagocytosis. They can actually live for several months and are effective against, and because of that, are effective against chronic infections. Lymphocytes are actually, excuse me, monocytes are actually capable of leaving the bloodstream as well and going into the tissues, and they actually get a new name when they've done that. They're then called macrophages, so you'll hear that word as well. Macrophages in the tissues engulf the pathogens there, and also they help to eliminate the old, worn out, don't function so well red blood cells. All right, the last group of the white blood cells, we've got the lymphocytes. They play an important role in the body's immune system. They produce antibodies and other substances that help to destroy pathogens, and they can live a few days to several years. Lymphocytes can actually also be further subdivided into T cells, B cells, and NK or natural killer cells. T cells, and just give you a really brief what they do. T cells will direct the cell-mediated immune response. In other words, they help other cells to perform their jobs. The B cells, they produce antibodies. And that's kind of the main gist of what they do, though there are some other parts to that as well. The NK or natural killer cells rapidly respond to stressed or infected cells, and they target the cells infected with viruses or abnormal cells. And what they do is the NK cells can actually, they get to their target cell, they actually break through the cell's membrane, release a chemical that causes that cell to lyse, or another word for lyse is to break up. All right, platelets. Okay, this is the last one of the cellular or formed portion of the blood. Platelets, also known as thrombocytes, are the smallest of the cellular components of blood. They are not actually complete cells. They're actually fragments of larger cells. Each platelet remains in circulation for about 9 to 12 days. The normal average adult has 150,000 to 450,000 per cubic millimeter of blood, and they are the first to arrive at the site of injury. Therefore, they play a very important role in preventing blood loss. Essentially, these platelets stick to the injured site, create a platelet plug to slow and stop the bleeding. And in addition to like sticking there, right, and forming a plug, they also secrete serotonin, which causes our blood vessels to spasm. And when we say spasming of the blood vessels, we mean constricting. So that's another way in which they prevent, or not prevent, but slow or stop the flow of blood. So then I mentioned there was the liquid or plasma component of blood. Plasma is the liquid portion of unclotted blood, and it's made up of water, nutrients, hormones, electrolytes, proteins, waste, and other protective substances. Water makes up 90 to 92% of plasma. Nutrients, these are minerals that are passed through the digestive system directly into the bloodstream. We're talking like cholesterol, amino acids, glucose, fatty acids. Hormones, such as insulin. We talked about hormones in the endocrine system. Our various electrolytes are found in the plasma or liquid component of blood. This is our sodium, potassium, calcium, magnesium, and chloride. These are used for many chemical processes in the body. Proteins, we're specifically taught when we're talking about proteins here, we're talking about fibrinogen, globulins, and albumin. And I'm just going to mention quickly what those do. So fibrinogen is a protein that aids in clotting. Globulins are proteins that are manufactured to help fight off foreign invaders. Albumin is the most abundant of the plasma proteins, and it helps to pull water into the bloodstream and also regulate, and therefore regulate blood pressure. Within the liquid or plasma component of blood, I also mentioned waste and protective substances. Waste, this is what we've already talked about. It's what is pulled out, removed from the tissues, the cells that are not needed anymore, and brought to the proper organ for excretion and removal. Protective substances, this is just, these these are like antitoxins and agglutinin. These assist white blood cells in destruction of microorganisms. All right, let me make sure there's nothing else here that I want to talk about. All right, let's move on. So let's talk about hemostasis. Hemostasis and blood coagulation. Both venipuncture and dermal puncture will create injuries to the blood vessels, as you know. Hemostasis, like I mentioned, is the stopping of blood. There are 4 major events involved in the stopping of blood flow that are listed there. You've got blood vessel spasm, which for minor or small vessel injury, often the blood vessel spasm or vasoconstriction is enough to stop the bleeding and nothing else needs to be done. After that, there's platelet plug formation, which we talked a little bit about. This is also known as primary hemostasis. Blood clotting or coagulation, you may hear the term coagulation cascade. This is a series of things that happen when the coagulation process is occurring. Let me talk a little bit more about that. Extensive injury to larger blood vessels typically requires all of the steps in this hemostasis or stopping of the blood process. Coagulation requires the presence of specific clotting factors to form a clot. So when an injury happens, these clotting factors, calcium ions, platelet factors, they all join together to produce thrombin. Thrombin is an enzyme. So thrombin is used to convert fibrinogen into fibrin, okay? Fibrin is an elastic protein that adheres to an injury site, and that fibrin is what collects our platelets, collects our blood cells, collects our other particles, and actually forms the clot. This process takes several minutes and is known as secondary hemostasis. Again, we're talking here about a coagulation cascade. So finally, you need the clot to break up after it's served its purpose. So when the clots, when they form, actually stimulate the growth of fibroblasts and smooth muscle cells. And the final step in this clotting process is actually dissolving that clot back up so that the vessels can return to normal function. All right, let's talk a little bit about blood types and Rh factor. Blood types are distinguished from each other in part by their antigens and antibodies. Antigens are inherited proteins on the surface of individual red blood cells. So type A individuals have the antigen A on the surface of their red blood cells. Type B have the B antigen on the surface of their red blood cells, and type AB have both A and B antigens on the surface of their red blood cells. Type AB people are considered universal recipients because most of them can receive all A, B, and O blood types without a transfusion reaction. Type O, they have neither antigen A nor B on the surface of their red blood cells, and they're often called the universal donors because their red blood cells can be given to most people regardless of the recipient's blood type. And actually, O negative is the official, I don't know if that's right, that's a better word, a truly universal donor because they have neither A, B, or D antigens, and D is related to the Rh factor, which I'm going to talk about here in just a second, or maybe right now. So Rh factor or D antigen is present on red blood cells. So people who are Rh positive have Rh antigens on the surface of their red blood cells. What it's important to know Rh positive or negative when we're doing blood cell transfusions. So what happens is if an Rh negative person is given Rh positive blood the first time, they just develop the antibodies that bind to the Rh antigen. And usually it's not a big issue that first time. But if they receive blood a second time that is Rh positive, they're going to have agglutination occur and they're going to have a reaction. And then, of course, we think about this when we think about moms and babies. If an Rh negative female has a baby with an Rh positive male, there's a 50-50% chance that the fetus will be Rh positive. After birth, when the Rh positive blood of the fetus mixes with the Rh negative blood of the mom, the mom develops antibodies. The first Rh positive baby doesn't usually have any antibodies, so they don't usually have any issues. But if the mom conceives a second Rh positive baby, that baby's blood will be attacked by the mom's antibodies right away, and the baby will develop a condition called erythroblastosis fetalis, or hemolytic disease of the fetus in newborn, HDFN. What happens when these babies are born is they are severely anemic. They need multiple blood transfusions, but it can all be prevented by testing blood and knowing if an Rh negative woman, or she can get something called, you've probably heard the name that you've probably heard is Rogam, but essentially what it is a drug that suppresses the production of these anti-D antibodies. So transfusion reactions, I think that's the last thing I'm going to mention on here. These occur when a patient is transfused with blood to which they have an antibody. So they have a reaction. Agglutination occurs, followed by hemolysis. Reactions can range from mild to deadly. So phlebotomists frequently draw blood that's used to determine a patient's blood type so that it can be cross-matched with the appropriate blood donor. Proper identification of your patients is always important. Proper labeling is always important, but this is a good example of why, right? Because to prevent transfusion reactions, we need to always use 2 patient identifiers. We need to make sure that blood and blood products and specimens are always labeled correctly. All right, so there we go. Like I mentioned, I think it's about 4 to maybe even 5 videos that I have attached under this lecture most of them are about 5 minutes long. There is one that's a little bit longer than that, but try and watch them because it might help tie some things together for you when we're talking about the cardiovascular or circulatory system. And I think you will really enjoy the little video clips as well. Please let us know if you have any questions, especially in preparation for your collaboration night and your in-person night with Michelle, because we can review over some of these areas and topics that are a little bit more challenging. Make sure to practice working your way through the circulatory system, in regards to the coronary, pulmonary, and systemic circulation, and having a better grasp on that as well. And I think that's all. So thanks for tuning in. Bye.